Hi, this is Dr. Ashish Deshpande again, and this is the second module of disease education that I conduct. So, if you are seeing this module, what it means is that you have seen the previous one. If you have not seen the previous module, please go through the module 1 before you reach here. So, the last time we talked about what's happening in my life and why is it happening. Today we are going to talk about furthermore what it could do further in your life. Okay, so listen to me and just try to understand important concept of co-occurring disorders. You know, when I was in residency, I used to see patients who had substance use disorder, and then they would go to a person who had a lived experience, and he would carry his treatment and I would carry my treatment, and we didn't talk to each other. Now we realize that it's one person who has the disease, and there are multiple skills that are required to help a person who is suffering from this disease. So we all experts, so-called experts, we need to come together and share our notes in order to help the patient the best. And that's what we do at our rehabilitation center. So apart from knowing what the disease is, we need to know what the disease can do in your brain. So let's go ahead and try to understand. Now let's summarize what we learned last time. So we saw that this is a disease of the brain, and of course the mind sits in the brain. The mind has various circuits: the reward circuits, the motivational circuits, the desire circuits, the memory circuits, the stress circuits, the attention deficit circuits. And what these addictive substances apparently do is that they engage all these circuits and they twist them a bit. Now this twist depends on the genetic vulnerability and the repetitive exposure that these chemicals can have on your brain. And because of that, we have biological damage. Obviously, these chemicals are not the best of healthy chemicals that you can think of. So they cause a lot of damage in the body. They cause a lot of change in the thinking, thinking and feelings that we have. And that's what the psychological damage is. And because of the change in thinking and feeling, your responses become difficult, behavior becomes sometimes rude, sometimes difficult for people to understand, and sometimes completely plain simple obnoxious. And because of that, the relationship starts breaking down and we have the social deterioration. And people don't understand, why the hell would you behave in a particular way? What has gone wrong with this substance? Why doesn't he understand what is right, what is wrong, what is good, what is bad? And they feel that they have a spiritual problem. So there is spiritual bankruptcy. So all these symptoms, each person may have different proportions of it, but they do come up in this disease, and that's what we call as a disease of substance-related disorder, substance use disorder. Last time we saw this seesaw. Yeah, the first exposure, you enjoyed it, and as you were enjoying it, you did not know that there are certain changes happening in the addiction center itself. And with repetitive exposures, these changes, the glutamate changes kept on happening. The population of these thin men in the addiction center went on increasing, tilted the seesaw, created the urge for dopamine. And once that urge was created, then you were compelled to drink in spite of knowing that this is not doing good to your life. Now you could be anywhere in this cycle. You could be at this stage where you are enjoying, but gradually choosing to get into those substances more frequently. The amounts of those frequent substances that you might be consuming might be increasing. You might be choosing to consume that substance more often, in more amounts, and when you are bored, when you are stressed, when you are happy, when you are sad, in whatever mood states. So for all the problems or even no problems in your life, the substance starts becoming a companion. Now I've drawn, for the sake of helping to you to understand, a drink, okay, but it could apply to even drugs. So let's try to find out what else these drugs do. We call these changes super stimulant effect. Okay. Now the glutamatergic population that was increasing, we call it enhancement. That's the super stimulant effect that I am talking about. And which are the drugs that can cause? If you are an Indian, it's very easy to remember. CSK, Dhoni, C. Yeah, IPL, right? So CSK, Dhoni, C is an acronym for all these chemicals which can have a super stimulant effect. So C stands for, CN is depressants, S stands for stimulants, K stands for cannabis, D stands for designers, H stands for hallucinogens, O stands for obviously opiates and nicotine, I is for inhalants, and C is for caffeine related products. Apart from CSK, Dhoni, C, there are certain behaviors, or we call them process addictions. So these addictive behaviors are like internet gaming, shopping, sexuality, gambling, and internet gaming. So all these things in vulnerable brains can create the superstimulant effect. And once that superstimulant effect is created, then the mind starts getting preoccupied with procuring the same experience again and again, and the motivation and desire circuit gets recruited, the memory circuit gets recruited, the stress circuits get recruited, and it creates multiple problems for the person who has this problem. Now, if you are listening to me, it means that you have realized that something is wrong with me. At least you have listened to your family member who has got this video for you. So somewhere you understand that you need to listen to somebody because they seem to be observing that there is something that is amiss. Now it is possible that you have realized that you should do something about your drugs or alcohol or whatever that you are consuming. Now what usually happens, okay, is that even if you decide that yes, I'm good quitting, okay, and many a times many of my friends are able to quit. They are able to stop their consumption, and then the argument is, see, I can control. So you say that I don't have control, but see, I can control. And that is what I want you guys to understand, that how does this work in the brain? Because common experience is people who have this vulnerability, this change in the brain, these people keep relapsing. Now let's try to understand why these relapses happen. So suppose you have decided to stop, okay? With heart and soul you have decided this is not good for me, my family is upset, it's hurting my health, it's hurting my love work, it's hurting me financially. So I want to stop. So you have decided I'm quitting, okay? And for whatever reason, okay, you might be wanting to quit, your motivation is extremely high. Okay, you are scared, you are threatened, you are hurt, whatever it is. You have decided to stop the consumption. Now, this motivation itself suppresses the dopamine levels. So it says that, okay, even if there is craving, I'm not going to allow you to keep jumping. So, because of the motivation, in spite of this seesaw is tilted, the motivational levels suppress the rise of dopamine. And then what happens is that some triggers, okay, now we have learned that there are two categories of triggers. Some triggers which are external and some triggers that are internal. So what are the external triggers? People, places, situations, and things. So when you come across people with whom you used to consume, places where you used to consume, the situations in which you used to consume, or the paraphernalia that you would use while consuming. Now, if you get closer to these external triggers, something in the brain goes wrong. There are certain internal triggers also. Those internal triggers, what we know is hungry, angry, lonely, and tired. We call it HALT, H-A-L-T, hungry, angry, lonely, and tired. So whenever the person comes across, now these are the things that can happen to anybody, they are all around us, and you can experience them, but what we know is that if you are exposed to these triggers, then the brain starts behaving little funny. And all the resolve that you have of not allowing the dopamine to rise up suddenly dissolves, disappears into thin air. And the brain starts rationalizing that how the next consumption, okay, is a reasonable choice that you are making. And maybe it also convinces you that the next consumption should not be the crazy consumption that you have had in the past, but it should be a controlled one. And when that happens, well, these triggers gaslight the glutamates, and the milk comes to the boil. And when it starts overflowing, at that time, suddenly the pressure of dopamine increases, your motivations fall short, and there is a chance of relapse. This chance of relapse, okay, makes you uncomfortable. We call it post-acute withdrawal syndrome. That post-acute withdrawal syndrome is an experience that might make you very uncomfortable. There's an acronym for that. I call it I''M Alcest, ALCEEST. I'll come again. I''M ALCEEST. What does it mean? I stands for irritability, M stands for mood swings, A stands for anxiety, L stands for low. What becomes low? Your concentration, your energy levels, and your self-esteem. S stands for sleep disturbances, and T stands for tiredness. Whenever these triggers are there, okay, it is very much possible that immediately the craving may not come in. But gradually, through the back doors of the mind, these symptoms make the entry. And they create an environment in your mind for taking the substance. So the last step of all these things that can happen in your mind is the consumption. And in spite of knowing that this is not possible, you will not be able to control your drinks to the normal that people consume. In spite of knowing that your experience teaches you something else, the brain lands up taking the wrong decision. And that's why we say that stopping the substance is easy, staying stopped is difficult. Is it impossible? No, but it certainly becomes difficult. And that is the reason why just stopping is not sufficient treatment. Going to a detox is an important step, but it's not the end of the treatment. Going to the rehab is not the end of the treatment. You will have to continuously practice the strategies that you have learned in order to prevent a relapse. And that is where the complete treatment lies. Many a times my friends believe that, okay, I went to the detox, I went to the doctor, I went to the rehabilitation center, I'm clean now, I'm damn motivated, and I'll see to it that I'll remain sober. But whenever there are stressful situations, there are lures, at that time the temptation becomes very difficult to manage. As Oscar Wilde has said, I can resist anything and everything except temptation. And your temptation, my friends, is 1,000 times more than the temptation that is perceived by a non-addict or a non-alcoholic. It's some kind of a passionate attraction towards that substance which is mutually shared. And that is where the unmanageability or uncontrollability of urge comes in. And that reflects in the post-acute withdrawal syndrome. And when that post-acute withdrawal syndrome happens, at that time, it is extremely difficult for you to stop yourself. And there you need to know that sometimes just 20 to 30 minutes of a chat with your counselor or a person who has experienced this behavior, this particular post-acute withdrawal syndrome, can relieve you from the stresses of the post-acute withdrawal syndrome. Taking a cold water bath, okay, going for a jog certainly helps. Going away from the triggers, whatever that is triggering you, just go away. Talk to somebody, that also helps. But that doesn't assure you that again the post-acute withdrawal may not happen. It doesn't assure you. But you will be able to tide over the crisis. How good you would be able to tide over the crisis will decide whether you will relapse or not. And that is where the individual counseling, the cognitive behavioral therapy, the group therapy, everything becomes handy. So you will have to use all your resources, whatever that you have learned in the relapse, in the group therapies, in the individual counseling, whatever that you have learned. If you are able to apply it here, then the things are going to work out good for you. Okay, so let's try to understand, how do you probably get away from people? Yeah, some of them could be your family members. So obviously it is not possible that you will be able to go away from your own house, which might be a trigger, or the place where you live, or the people that you are living with. Okay, so what you need to have is a proper practical relapse prevention plan. Okay, now that practical, the word practical is extremely important. It has to be implementable. Okay, so you have to work with your counselor. Whoever is your counselor, you have to work with your counselor and make a tailor-made relapse prevention plan for yourself. And in order to understand what your needs are, what your desires are, okay, we might require some personality assessments, because you know yourself for donkey's years, but as therapists, we need to know what kind of a person we are interacting with. And that's the reason when in our rehabilitation center, once the detoxification is done and you settle down in the treatment process, the first thing that we do is personality assessment. And we try to find out what are the thinking patterns that we are using, what are the feeling patterns that you are dealing with, how much of thinking and feeling has impacted on your emotionality. And if that emotionality has been impacted, and many a times in an addict's life there are multiple things that are going on and the life is in a mess. So whenever that happens, how far has it affected the brain in order to cause psychiatric illnesses? Yes, you hear me right. With addictive substances, you could have other psychiatric illnesses. So let's try to figure out how we can deal with this. Yeah, my grandmother also used to tell me that, you have to eat well and sleep well and meditate and hydrate and analyze things before jumping to conclusions. Yes, there is where the counseling comes in, acceptance. You have to first accept what kind of a body you have, what kind of limitations you have, and then you have to keep creating options for yourself. You have to be reasonable, you have to accept what your problems are. And if you do these things, your health is not likely to deteriorate. But what is important is that, where do you find these other people? Where do you find these other places? Because many a times an addict and alcoholic spends about 8 years to 10 years to 15 years consuming. So he has selected a group of people, all of whom are consuming. His social interactions have consumption of alcohol, and it becomes very difficult to disconnect and reconnect with somebody. And that reconnection also with people who are not going to consume, okay, becomes rather difficult, because you don't have any topics to discuss, share, talk about, and socializing becomes a big hindrance. Okay, so where are you going to find these people? And that is where, people give up, okay, on their efforts to stay stopped. Okay, and many a times what I've seen is that they become isolated. Okay, they become withdrawn because they don't know. They know that they don't want to meet people who are consuming, but then whom do they meet? And they become uncomfortable because of their loneliness. And you remember that loneliness is also a trigger. So not meeting people or just trying to put a big stone on your head and just carry your cross, saying that, okay, each man has to carry his own cross, that doesn't help here. You need to find an alternative way of connecting with like-minded people. Okay, so that is how you have to create those situations wherein you would interact with people who are sailing in the same boat, maybe fighting the addiction. That's why it is important to have a social support system. So any rehabilitation center that you are in, once you get out of the rehabilitation place, you have to be in a social support system. If there is a social support system, then that gives you a comfort cushion that you would be able to share and be heard in those groups, and you will be able to have somebody to talk to when you have a post-acute withdrawal syndrome. And that is the importance of having to connect with people who would be supportive. And working on all these things, okay, just because you are in recovery, these people are not going to come, these situations, these things are not going to reach you. You will have to make yourself visible with your effort in recovery. You will have to take that first step of seeking help. So you have taken the first step of watching this video, maybe connecting with a rehabilitation center of your own choice, or the intensive outpatient program that could be there. But beyond that, you will have to work on creating the support systems that I am talking about. Okay, so as I was talking, that all the effort that you have to put in, okay, is called the relapse prevention plan, making of a relapse prevention plan. Okay, so that's what you have to do in your recovery, right? Now, obviously, all these things that you need to do have to do with a purpose. So you need to be convinced that you need to be out of this problem, right? So the simplest thing is, oh, these drugs cause a lot of physical health problems. 80 lakh people die of nicotine, 20 lakh people die of alcohol, and about 25 lakh people die of all these other illegal drugs, okay? And they literally screw up all the systems, and there is no one system that is spared by these addictive substances. But fear doesn't work, sir, okay? Fear doesn't work, okay? Because once the motivation and desire sets in, the medical complication is a long-term consequence. The immediate consequence is the feeling of bliss. And that is the reason it's a human issue. The negative consequences of drugs is a human issue. Currently, what you believe in is that if I take the drug, I'm going to feel bliss, right? And that is where the brain starts going, and it disconnects you from the consequences. So now, obviously, if you want to have some kind of a control in post-acute withdrawal syndrome, your brain will have to be efficient. And in the past, it has failed to show that efficiency. Now, why is it that the brain has shown this inefficiency? Let's try to understand that. So we know that this is the addictive center, and the glutamate levels have increased in this center, right? So if glutamate levels increase in this area, now this area is not absolutely walled from the other areas. So there are these pathways, these neuronal circuits which change the way the whole brain starts interacting, and at the same time the chemical changes here would directly go into the surrounding areas. Now what are those surrounding areas? We have the emotional brain. The circuits go right up to the thinking brain. So your emotions are affected, your thinking is affected. Now these chemical changes, okay, which affect the surrounding areas, it depends on the concentration of these areas, right? Osmosis, okay, so directly affecting the surrounding areas. Now we know that some of the changes that happen because of the chemical influence, they have something like a valve. Okay, now these valves could open up when the chemical changes happen and the chemical traverses from one side to the other side. Now when it happens, if the valve shuts up and doesn't allow the chemical to revert, then you have a problem, because now the chemical change that has happened in that area has become permanent. But if you are lucky, then as you stop consuming the substance, as the concentration of glutamates in this area starts ebbing, then automatically the chemical levels start receding back. And when that happens, the affection of functions of these surrounding areas start reverting. So what it means is that when you are consuming, if your thoughts and feelings are affected, when you stop consuming, the thoughts and feelings come back to normalcy. But in unfortunate cases, the speed of those thoughts and feelings receding will decide, after stopping the consumption of the illicit substance, how soon these chemical changes that have altered the surrounding area and affected your thinking and feeling might come back to normalcy. If it persists beyond the phase of biological half-life or intoxication, then we call them substance-induced problems. So substance have induced another problem in the brain, and they persist even when the substance has gone away from the body. Now those are called substance-induced problems. Okay? So what happens is that which are the chemicals that get affected? We know that one of the chemical is dopamine, which we know that it's associated with pleasure and tolerance, but we also know that it can give you delusions and hallucinations. So psychosis is one of the substance-induced disorder. The second is GABA. Now GABA is a calming medicine calming drug in the brain. So it's essential for sleep. So if GABA is deficient, you have withdrawals, which causes a lot of restlessness and sleep disturbances. So if in the initial stages there are withdrawals associated with GABAergic interference, in later stages you don't sleep well. So you have something called insomnia. In spite of you have stopped the chemical, but you don't sleep well. This also can become a trigger taking you back to your drugs. The third chemical that gets affected, system that gets affected, is the GABAergic system, serotonergic system, and the opioid system. Now these systems are associated with a mental phenomenon of denial, not accepting what the problem is. Now we know that yes, after taking some of the illicit substances, you lose track of yourself. You land up doing things which you would not do otherwise. Now why does it happen? Why does it affect the self-experience? It's because of chemical imbalances in some areas of the brain which give us idea about self. Okay, now there are various areas in the brain like insula or precuneum, especially the anterior portions of the precuneum, which are associated with self-experience. And when these areas are affected, the self-experiences start altering. And that is where even the addictive substances act, and you start getting the out-of-body experiences. So these out-of-body experiences, when you stop taking drugs, do not necessarily get well at the drop of the hat. So it is very much possible that the person is likely to have some impact on understanding what is happening to his life, and that is called denial or acceptance. Okay, so that is how. And the last system that gets affected is the stress system or the emotional system. And because of that, there are multiple chemicals that are involved, but what we know is that the person's coping skills and his emotionality gets affected. And when that gets affected, the person becomes a sitting duck to relapses. Because every single time there is a stressful situation, which might not be stressful to a normal individual, but when he reaches the stressful situation, the person experiences intense desire to increase the dopamine levels, and his motivation falls short of controlling the urge, and he keeps relapsing. So what we know is that if you have the desire to stop, then there are multiple factors that might interfere with that desire. And those multiple factors, one of them is just an impulse that comes up. The second is emotionality. The third is lack of disease education and feeling that you will be able to control the substance the next time. So there is a big book in Alcoholics Anonymous. It says in one of its paragraphs that every alcoholic carries this dream of controlled drinking, but he carries that dream to his cemetery. So friends, it's a relapsing disease. It's a deceptive disease. It chooses to use your own thoughts and feelings in order to rationalize the next consumption. Albert Einstein once said that according to him, insanity was doing the same thing and expecting a different outcome. What we believe as the addiction experts is that once you consume the substance, that's not insanity. What happens after that is not insanity. But what convinces you that in spite of your experience of the past, what convinces you that you will be able to control it the next time? And in order to cure yourself from insanity, you will have to have some hand-holding in creating a relapse prevention plan. So in that, you will have to work on your emotionality and coping skills and your denials. The withdrawals can be assisted with medicines, but these things need to be through talk therapy. And in that, we need to know your personality, what your coping style skills are, and how far these neurotransmitter systems have been affected. So what you will be going through in the assessment, in the rehabilitation center, is part of these changes that I am talking about. So friends, this is what is required for relapse prevention. So I hope you have enjoyed this session and you have understood that if you have a disease, stopping is easy, staying stopped is difficult. And if you want to stay stopped, friends, you need to create a relapse prevention plan. So that's what you need to do. Thank you very much for your time, and see you in the module number 3, which will talk about what about recovery. We have talked enough about the disease. Now what about recovery? So keep in touch. Until then, be sober. Thank you so much.